Well, good evening, and welcome to our first ever virtual town hall, coming to you live tonight from our recently repainted sanctuary. And we look forward to sharing with you until about 8:15, or until all of the questions run out. Our focus tonight will be to share with you some important information and updates regarding our plans to reopen the church for worship. But before we get into all of that, would you join me, please, in prayer? So, Father God, we give you thanks for your great love for us. We give you thanks for this opportunity for us to be together as the family, even though it is in a different way than we are used to gathering. We thank you for the reality that you loved us before we even first turned to you, and that you promised that as we seek wisdom from you, you delight in giving it to us. So, Lord, would you give us wisdom? Would you give us a strong sense of your presence guiding us as a church? And would you give us, please, a unity of the Spirit that we will know is from you as we gather together and as we go forward as your church, in Jesus' name, amen. So thank you again for tuning in. Thank you for taking our survey. It's very important as we listen, as we go forward, for you to know that we are listening very closely to what you have to say, and we'll be playing some of the information back to you tonight that you have heard. As you'll see, I'm with Manish Shah and Mark Potter, who are the co-chairs of our reopening task force, and they're going to do the majority of the presenting tonight, and I'm going to kind of act as your MC. I also want you to know that this task force that Manish and Mark represent totals 15 people in total formally, but probably another 15 or 20 informally in terms of the people that we have reached out to for resources. I also wish I could flip the camera around and show you the people that are here from our media and production communications team. Friends, I hope you realize that they are working almost 7 days a week, 18 hours a day to bring you the different things that we're bringing you, and I am just so very, very grateful to each and every one of them, and hope that one day when we're allowed to hug, that you'll just come up and give each of them a big old hug of gratitude for what they are doing on behalf of the kingdom and on behalf of this church. I'm going to cut right to the chase, and then I'm going to turn it over to Manish. Several weeks ago, we told you that the goal for our session in terms of reopening the church for worship was going to be Sunday, May 31st. I want to tell you right off the top that session last night voted to push that date back 2 Sundays to Sunday, June 14th. And our purpose tonight is to tell you why and how that decision was made, the data that we used to make it, and to also talk a little bit about what things are going to look like when we do reopen on the 14th. So thank you again for being with us tonight, and now I'd like to turn it over to Manish Shah.
Thanks, Jim. So good evening, and tonight it is a pleasure to be with you here to share an update on what our church's reopening task force has developed and what our session has approved as a plan to move forward. And we know that God has designed us to be in worship, and we know that God has designed us to be in community. And so for that reason, we know that many of us have experienced the difficulty of not being in person in worship, and we lament that loss with you. Spending some time reading the Psalms of Lament when this pandemic first started was definitely a source of comfort for me, because I realized that it's okay for us to cry out to God with those laments. But at the same time, in doing so, it was a comfort because I realized and was reminded of God's faithfulness to us. And so we know that from the feedback that we've received from the congregation, that many of you are eager to return to in-person worship. We also know that there are also many of you who are concerned and want to be cautious and feel safe when you choose to return. And so being mindful of all of those perspectives is what our task force considered when we came up with the recommendations that we're going to share with you this evening. And we believe that those recommendations are both loving to our neighbors and are safe. So now I'm going to turn it over to Mark.
With regards to the aim and the structure of the task force, our aim was to determine the criteria, guidelines, and processes to gradually reopen the church building so we can get our staff back, to resume Sunday morning worship, and to offer summer activities as appropriate. Manish and I were the co-chairs, and we also had several members of our elders and members of our staff who you'll see at the bottom of the slide. And I'll give you a second to look at that. Okay, next slide, please. Okay, this slide will describe the process that we used. We summarized guidance from both governmental and medical resources, which you can see there, White House, CDC, State of Texas, and TMC resources. We've also reviewed other information from other churches that have already opened. Jim is very well connected with the other members of the faith community, and so is our Cheryl Christie. So we incorporated experiences that have already happened. We've evaluated published data from the literature that the task force collected, and we surveyed you to assess your needs as a congregation. We're going to present the results from the survey now. We learned a lot from the 510 of you who returned your surveys. That's what the N equals 510 means. 63% of you were longtime attendees, and many of you were over 50 years old. But as you can see, all ages were represented, and we also heard from a fair number of young adults and also from families with children. Next slide. Many of you want to return right now, 46%, but of those 46%, you also have a need to return with a feeling of safety, so you might not be coming right away. 20% of you want to wait until COVID cases in Houston have plateaued for at least 7 days, and an additional 46% of you will return when the COVID cases are declining. 4 practices that will alleviate concerns the most are physical distancing, masking, clean, safe, sanitized, and disinfected building, and hand sanitizer availability. Manish?
Thanks, Mark. And that was just a snapshot of some of the results from the survey, but please know that we looked at all of them, and we just wanted to give you a little bit of the highlights from the survey results that we reviewed. So now I'm going to talk about the start triggers that our task force developed and our session has approved to resume in-person worship. And there are 4 of them that must be met. The 2 that have already been met are noted with a green check mark, and the other 2 that have not yet been met are noted with the red X mark. And so the first is that local officials state that it is okay to resume worship, and that has happened. The second is that at least 20% of the congregation is ready to return to in-person worship. And we know from the results of our survey that at least 20% of you are ready to return in worship, and it's even more than that. However, in order for us to be ready to open and to do it well, all of the infection control precautions that I'm going to cover in a few moments must be tested and implemented. And we need to make sure that we can do it correctly, and we need to make sure that we are prepared to implement them fully when we open in person. And so that will take until June 14th, as Jim mentioned earlier, and that is our goal for a logistical target to be ready to resume in-person worship. And then finally, we felt that it was important, especially based on the feedback that you gave us and from the discussions of our task force and the advice of our medical advisory group, which is composed of 5 physicians, including myself, from the congregation, to use some local data to determine when it is safe to resume in-person worship. And so what we decided as a task force was to look over trends over a 7-day period, that hospitalizations are decreasing, that the rate of rise in cases is not increasing significantly, and that new cases over a 7-day period are not increasing significantly as well. And so these are just 3 metrics that we plan to look at. There are others, but we do plan to be intentional about looking at these since they do represent what is happening in our local Houston community. And so next I'll talk about the target dates. I already mentioned, and Jim did as well, that logistically we need some time to get ready to resume in-person worship, which means having a large number of people come to the building. And that will start when all 4 triggers are met. However, we already know that staff are coming on site. As Jim mentioned, our media crew has been hard at work over the past 2 months. And other staff that work at the church need to also be able to come on site. And we know that there's a need and a desire for visitors to come as well. And so by June 1st, we plan to have that process in place so that the staff of the church can come and visitors by appointment can also come to the church building. And then finally, after in-person worship resumes, then that will be a time after that when small groups can resume on site, and that's for meetings or for Bible study or for other things. And that date is yet to be determined, but it would only occur after in-person worship has resumed. And in terms of triggers to stop large gatherings, I think it is important for us to be mindful of this, and our task force has discussed this as well. As you may have heard in the media, that there have been churches that have had outbreaks, and we want to be prepared to determine what are we going to do in advance if something like that were to happen, though it is our intention to do everything possible to prevent that from happening. And so if a confirmed outbreak occurs, which we're defining as there are multiple confirmed infections in people who have attended the same worship service in person, that would be one reason to stop having in-person worship or other large gatherings inside the facility. In addition, if for some reason our medical advisory group felt that it was necessary to stop based on our interpretation of local data, that would be another reason. And then finally, if there were a public health directive from the county or the state to mandate that, then we would also stop. Similarly, people are probably also wondering, well, when would we be able to resume having in-person worship without all of these infection control precautions in place? When could we come, to put it in simpler terms, when could we just come back like normal? And really that is, the relaxing of infection control measures, it really could not occur until we see a significant decline in the downward trajectory of cases in the local area over a prolonged period of time. And so we've defined that to be a 28-day period. And so I'm going to turn it over to Jim to talk about worship style, timing, and the format of worship.
Thanks, Manish. So we're going to start by kind of telling you what worship is going to look like, and then I'm going to flip it back to Manish, and he's going to tell you what it's going to look like to walk into worship. But on the 14th of June, we will begin with one in-person worship service at 1045 here in the sanctuary. It will be blended, not so much in the sense that we'll try to have all of our worship styles in one service, but that we will continue the practice that you've seen in our live streams of drawing on the best of all of our worship traditions and the best of all of our worship styles and musicians. And so we'll begin with one service live in person at 10:45 a.m. At the same time, we will have a pre-recorded live-streamed service that will also run at 10:45. That will have been recorded several days prior to the Sunday of worship, and so obviously there won't be anybody attending that worship service as we record it, and we will not be live streaming the in-person service. Over several weeks, as we get our entry and exit logistics down as we make sure that we've got all of our infectious control practices down, and as we learn how to do these services well, then we will add a contemporary service, and we'll begin to separate a contemporary service and a traditional service, as is FPC's tradition. So that's what worship will look like on the 14th, we pray. One in-person service at 10:45, and then one live stream service also at 10:45 for those who still will not feel comfortable coming into the sanctuary. Manish?
Thanks. So now I want to just walk through with you what to be prepared for when you decide to come to in-person worship when we first open. And so in returning to worship, we'll implement a set of infection control best practices, and we will test our processes in advance. And this is tonight is our first step in communicating those expectations to you. We will also do that in other ways online to help prepare you for what this will look like prior to returning to in-person worship. And so for your safety, individuals who are at highest risk of dying if infected with coronavirus are encouraged to worship from home. And so that includes people who are over 65 years of age, those who have a chronic lung disease or chronic heart disease, including moderate to severe asthma, those who have severe obesity, diabetes, a kidney disease that requires dialysis, liver disease, some form of immunocompromise, including cancer, and those who live in a nursing home or a long-term care facility. All of those people are at highest risk of having severe complications if infected with coronavirus, and so we ask you to worship at home for your safety. Based on what most of our high-risk individuals have noted on our congregational survey, we know that there are a number of you who want to come for in-person worship, and in doing so, if you choose to come, we will seat you in the sanctuary rather than a separate area, unless capacity has been reached and an overflow room is necessary. And that's for several reasons, but one of them is because you express that desire to be in the sanctuary. To anticipate capacity, we plan to implement an online registration tool in order to estimate the number of people that plan to worship in person each week. And during worship, children and youth must sit with an adult member of their household and properly wear a mask throughout the entire service and practice appropriate hand hygiene. There will not be on-site childcare or Sunday school, and those classes will not be open when we first open. And so children who are 0 to 4 years old will not be allowed on-site at this time due to the high rate of asymptomatic infections in those that are in this age group, and also the challenges of adhering to best practices with infection control in infants and toddlers of that age group. However, children who are 5 years old and up are welcome to come, but those who cannot adhere to infection control measures should worship from home. And so we advise the adults in those children's households to make that determination of what your child is able to do. And since worship will resume in the sanctuary first, and to minimize risk, we advise that everyone park in the north lot only and not park in the museum lot. And so now I'll talk about the screening process and what we will do for contact tracing. So all entry and exit points will be limited to one door upon entry to the facility so that active screening can take place. Anyone who enters the building will be verbally screened with questions about the past 14 days with respect to having symptoms of COVID-19, having had close contact with people who tested positive for the virus that causes COVID-19, and for those themselves who have tested positive in the past 14 days. And so anyone who answers yes to any of these questions will be asked to worship from home. And also, we advise those that do answer yes to any of those questions to contact their physician or Harris County Public Health to determine if they need to get tested and other follow-up steps that are necessary for your health. So these questions that will be used to screen will be available online so that you can look at them in advance for advanced consideration. And they will also be posted on signs as you arrive prior to entering the building. We will not take temperatures when you arrive, and we discussed this in detail about the advantages and disadvantages of doing so, and ultimately our task force decided not to do that because doing so would require being in close proximity to the screener and may pose an infection risk to both the screener and the individual, and so we have chosen not to do that. However, people will self-report symptoms, including the presence of fever in the past 14 days. And so if you have had a fever and you've taken your own temperature at home, then we ask that you worship at home. We have also learned from other churches that temperature screening has been problematic at churches and businesses. And so for that reason, we have chosen to have that be screened by self-report solely. If anyone has a confirmed positive test for being actively infected with the virus within 14 days after coming to the building, they are encouraged to voluntarily contact Harris County Public Health and also the church so that the church can collaborate with Harris County Public Health to ensure that other people who attended in person may be contacted. And so for that reason, we will be noting who has attended in person so that we can facilitate that process of contact tracing. So now I'll turn it over to Mark so he can talk specifically about the entry and exit procedure.
Yes, we are going to have a little different set of entry and exit procedures than you may be used to. We formulated these to be compliant with Governor Abbott's Reopen Texas guidelines for places of worship. When you arrive on campus, you're going to see a lot of signs, and these signs are going to remind you of hygiene habits and to remind you not to assemble in groups without proper social distancing while you're on campus and while you're returning to your cars. The doors will be propped open, so you will not have to touch a door, at least into the sanctuary. Seating will occur by household unit, and we will start from the front of the sanctuary, moving to the back as you arrive. Now, household unit, that is the people that live with you. So you're probably not going to be able to sit with the couple you've sat with for the last 20 years for at least a little bit. Also, there's a unique rule in Abbott's guidelines which says that two individuals who are not of the same household may enter together and sit together. I call this the boyfriend-girlfriend rule. It could also be applicable. It could be mom takes grandma to church rule. You may think of it that way. But basically, you're just going to be sitting with your family. You will be seated 6 feet apart from the nearest family, horizontally in the pews. And also, according to Governor Abbott's guidelines, we will be blocking off every other pew. So you can see this is really going to diminish the capacity of the sanctuary. You're not going to be in here with 300 other people. It says ushers, but actually the regular ushers are not going to be seating for a while. We're going to have a volunteer pool of, I would call, seaters, along with the volunteer pool of screeners that are drawn from our elder pool and from our staff. When we're leaving, we're going to reverse it. So we will dismiss you from the first level of the sanctuary from back to front. But before that, if we have people in the balcony, we'll dismiss people in the balcony from front to back, since they'll be seating back to front. I believe it's yours now, Manish.
Thanks. So once you're inside and seated, it's important for us to describe other infection control practices. And so I'll step back before you're actually seated. So once you've been screened, we will have everyone practice hand hygiene with hand sanitizer upon entry to the building. Everyone must wear a mask that covers your mouth and your nose at all times upon entering the building. And people should bring their own masks. However, the church will be prepared if you accidentally leave yours at home. Anyone who cannot tolerate wearing a mask for any reason should worship at home for the safety of those who are gathered. And so during worship, those who may temporarily remove their mask are those that are speaking or actively preaching from the chancel, or those who are singing while leading worship. There will not be a choir, and those singing to lead worship will be spaced at least 12 feet apart from each other and from the congregation. Also, all members of the congregation must wear a mask that entirely covers your mouth and your nose, even while singing. Items will not be passed hand to hand during worship service, so this includes bulletins, the offering, communion elements, and in addition, to avoid having other frequently touched things, hymnals and Bibles will be removed from the pews as an infection control measure. Frequently touched surfaces will be cleaned and sanitized or disinfected immediately before and after worship services. And food and beverages, including water and coffee, will not be served during worship or before or after, except for individually wrapped communion elements on days when communion is offered. Drinking fountains will also be shut off. Restrooms will also be modified to enhance physical distancing. And so now I'll turn it back over to Jim.
Okay, so in just a minute or two, we will begin to answer your questions. But I'd like to acknowledge something that I think is probably going on in the minds of many of you. Some of you are at this point expressing to yourself, or maybe to somebody that you're watching this with, extreme disappointment that you were expecting something different. We get that. I get that. Others of you are just flat out in disagreement with our policies or with our approach, or maybe with the whole idea that this was necessary in the first place. We get that. Others of you are listening and hearing this with a sense of relief of, okay, I do feel like I can come back and that I will be taken care of. That's our promise to you. And others of you are feeling relief that though you may not be ready to come back, we'll still continue with our online services, and so you'll be able to continue to worship not in the way that you want to, but in the way that we can in this particular season. I would just simply ask that as we go forward, we would all do our best to reflect on this scripture from Romans 15, the first couple of verses. It says, "We who are strong ought to bear with the failings of the weak and not to please ourselves. Each of us should please his neighbor for his good, to build him up." Now, if you read the larger context of that passage, Paul is not saying that some are strong and some are weak. What Paul is saying is those who feel they are right need to bear with those who disagree. I may feel I'm right about a certain situation and that Manish is wrong. It doesn't make me strong and him weak. It means that we disagree. As a follower of Christ, it's my calling, my responsibility to actually submit myself to Manish, that I might build him up, that I might encourage him, knowing that he's going to seek to do the same for me. And we're going to say this, we've been saying this from the beginning, that we're not doing these things out of a sense of fear. We're doing them out of a sense of love and a desire to take care of one another and to make sure that we are not responsible when we gather for causing illness among a member of our family or a member of those who come in contact with the FPC family. And I know that for those of you that were excited or are excited about coming back, all of a sudden you're realizing now that what you'll be coming back to, at least at the beginning, is not what you left back in mid-March. We all get that, and we all understand that, and we all know that this change is a loss. And we want to lament that and pray through that together. And just to be brutally honest with us, I think there's a good chance that this is going to be this way for a while. That we will pray that it isn't. We'll pray that everything that we're reading about in the news with respect to what's going on in Houston will just get better and better and better, and that we will get better and better at doing the things that we are called to do. But I hope that tonight we can begin to set the expectation that what you come back to is different, that what you come back to may be with us for a while, but we're still seeking the opportunity to come back and worship with one another. I will add one other thing, and then we'll get to the questions and answers. Many will say, well, wow, you guys sound pretty restrictive. I think, based on my conversations with other churches around the city, those that I've opened and those that are going to be opening within a week or two of us pretty much are all following the same guidelines. And so this is where we find ourselves these days, and we need to be all prayed up. We need to have our focus on Jesus, and we need to seek to bear up with one another in love. So with that, let's start taking your questions. I'm going to read them, and then I'm going to refer them to one of our two co-chairs here, or if I can, I'll answer them myself. So when will the church building be open for small group meetings outside of Sunday worship? Mark, can you handle that?
Sure. We don't know yet. We have been focusing in the facilities committee, which I am leading. We've been focusing, number one, on getting worship up and running, and number two, getting the staff back in, and that's basically taken 100% of our time. We do have it on the list, and we're going to start working on it soon. We want to get things open for session to have meetings. We want to get things open for trustees, for ministry team meetings, for Bible studies, for small groups during the week. Recognize, too, that anytime we have an event like that, the room's going to have to be set up. The room is going to have to be cleaned and sanitized afterwards. So it is not a trivial expense to start opening up right now. But we are working on it. We know it's a desire of the church. It's a desire of me to be able to come here outside of Sunday worship.
Okay, our next question. Manish, this looks like a question for you. Will there be a way to provide testing for a fee for all members and staff prior to attending services, perhaps by offering tests in the preceding week?
Thanks for this question. So, no, we don't plan to do this as a requirement. I would say that if people feel that they want to assure themselves and by going to get tested before they come to a large gathering, you have the freedom to do that by contacting your own physician to request that. But that will not be something that we have included or plan to include in our guidelines to ask of the congregation or of the staff.
Will sufficient quality masks be required and made available for those that don't have one? Manish, I think that's you.
Yes, so it is required, as I mentioned, that everyone who comes inside the building wear a mask that covers their mouth and nose unless they're actively speaking. So when I came today, I wore my mask. It's right here. And so did Mark, and so did Jim. And I only took it off right before we started the telecast. So yes, it is required. Will they be made available? So we ask that you bring your own masks. However, if you accidentally forget one, then yes, we will have some backups available to ensure that everyone who is coming inside is wearing a mask. In terms of the way that the question was worded, it said sufficient quality mask. So I think there might be a question under the question that I'll address. So a sufficient quality mask is anything that is a surgical mask like this, That's what I came in with today, and that is fine. In addition, if you want to create your own or purchase your own cloth mask that covers your mouth and nose, that is fine as well. It is not required to have something more than that. That is sufficient quality. So for example, you may have been watching in the news and hearing about things like an N95 mask. I work in the emergency department. I wear an N95 mask only when I'm doing something that might specifically create an aerosol generating procedure, like I'm suctioning someone or I'm doing something with someone's airway. And so for the purposes of church, a surgical mask is sufficient.
And Manish, just to state the obvious, I think we're kind of assuming that everybody has one, but if they don't, for some reason, we will have them available, right?
Yes, correct, yes. So we will have surgical style masks available if you accidentally forget yours or you don't have one right before you find out that worship's happening. But in preparation, because since we said that the earliest that we would be ready would be June 14th from a logistical point of view, you've got a few weeks to go find one if you plan to come the first day we're open.
This question is also for Manish. Will it be possible to do temperature checks?
So we, as a task force, did consider this option in our screening process, and we really did discuss the advantages and disadvantages of this. So with most most thermometers that you may be seeing in public, usually those are kinds that are infrared thermometers that one would have to get in close proximity, several inches away from your forehead to measure your temperature. And so we felt that, getting in that close of a distance with someone between the screener and the person being screened would compromise that 6-foot distancing that we're trying to maintain. And so that was one reason we didn't do it. We also know that there are other thermometers out there that you can take a temperature from several feet away. But at the same time, the other reason that we didn't choose to use this as a screening measure is that we felt that from talking to other churches and businesses that it may be a potentially flawed way to provide reassurance. So for example, if someone didn't have a fever when they arrived to church, but they had one yesterday, then we're going to be asking about that. If you've had a fever in the last 14 days, then we ask you to worship at home. And so whether you have a fever right at that moment when you arrive at church, we feel like that is not a reflective enough measure to determine that risk of fever. Also, if you had taken a medication like acetaminophen or ibuprofen a few hours before you came to church because you had a headache or you were feeling a little achy, then that could also bring your temperature down, and then we would get a false negative read on that temperature. So for a variety of reasons, we've chosen not to do that.
This next question says, will seating sections be assigned in case follow-up contact tracing needs to be conducted? Mark, it's
a little bit of both of us. Okay. We are not going to assign seating per se. Seating will be done first come, first serve, first through the medical screening. And as I said, we'll start downstairs, front to back, and then if we need to go into the balcony, we'll go back to front. I think Manish can talk about our contact tracing. We do have a plan for that.
Sure. So as Mark mentioned, we will be seating people in a way that is assigned by the person who is seating you. You will be told which row you're going to be sitting in based on when you arrive. We had considered actually taking down the exact location of where people sit. That is still a detail that we're finalizing. The other alternative that we have considered is if we have noted all of the names of those who attend in person and have contact information for them, that might even be better than noting exact locations because even if you didn't sit next to the person that might have tested positive, it's still worth notifying you because you might have passed them in the restroom or you might have passed them on your way out in the parking lot. And so just because you didn't sit next to them doesn't mean that you didn't come in contact with them while you were in the church building or just outside of the church building. And so for that reason, our task force thinks that it's most appropriate to notify everyone who attended in person if we become aware that someone tested positive. And we would do this in an anonymous manner and really defer that to Harris County Public Health to do that contact tracing, but facilitate that process with the county by giving them the names and the contact information of those that did attend.
If I can add one thing to that. I talked with Cheryl today in our facilities meeting, and we discussed the information that we can get out of the system we're going to have for you to, I wouldn't say reserve your seat, but let us know that you're coming. That's going to be through a system that's already in place in church. So we will have your contact information. We will get a printout, so when you come in, the seater will be able to check your name off the list. And if somebody just comes in without reserving, somebody comes in off the street, we'll take that down, pencil and paper, and get their contact information. So it'll be readily available. It's another advantage of using the, it's kind of like Eventbrite, that sort of thing, but it's through software the church already has.
Will there be a way to keep doors open so no door handles need to be touched? Mark, I think I'll toss that one to you.
To the extent possible, certainly all of the doors to the sanctuary will stay open until the point that we start the service. We'll be paying a little bit more for air conditioning, I think. Restrooms, probably not. We'll just have to sanitize those more.
This question, will our worship schedule interrupt Sunday school cover-to-cover study? Intersections is meeting from 9:30 to 10:30.
Yeah,
no, so I'm sorry.
Yeah, well, I could take that. There's one other Sunday school that's going to get bumped, and that's the one that I teach because we meet 9:30 to 10:30. And by 9:30, I better have myself in my car and on the way into town so I can help with worship. My advice would be do what we're doing. Contact the person that's leading your Sunday school and inform them that you would like to come to live worship, and maybe we can go about moving the class to accommodate those people.
Yeah, I'll say that I know that this actually came up as a specific suggestion from one of our task force members for us to be mindful of this. And so so we do think that it's important as we're gearing up to have in-person worship, because we know that the time will be at 10:45, you now have several weeks to discuss with your Sunday school class to decide if you need to slightly modify that time, if it's coming up right up against starting in-person worship, if you plan to come to in-person worship, because we also want to be mindful of that so that you can participate in your virtual Sunday school class, but then still come in person if you want to.
So this next question is I think particularly important as well as poignant. It says, I've heard singing can spread the virus, which more and more studies are coming out and reinforcing that point, correct?
Yes.
How can we enjoy the beauty of the choirs in worship and still be safe? And just the hard reality for a season is that the choir will not be singing. We will continue to have singers on the chancel and on the steps, but it will be a while before the choir comes back.
And several people, Jim included, have shared information with the rest of the task force regarding the specific risks related to singing. And so for that reason, we accommodated that guidance that we read from that literature by allowing extra distancing between singers so that they're 12 feet apart. And then also to make sure that there aren't a large number of singers as well. So it's a limited number of singers. But I think in terms of about the question about enjoying that type of style of worship, I think that our media team and our worship team have come up with many creative ways to enhance worship. And so I think that there are opportunities to be creative and innovative with that.
Yeah, in fact, let me mention this, that one of the things that we have learned over the last few weeks is that we have much more creative capability by pre-recording the service. So we will have the opportunity to hear the beauty of the choir in addition to our other musicians by pulling some of what we're starting to call the choir's greatest hits and playing those by video like we did on Easter if you happen to tune in for our Easter service. So I recognize that will be on our online service and not in-service worship, but we do hope that through the online we can keep hearing from our beautiful choir, our sanctuary singers, and our other musicians. The next question, how are we going to keep young families engaged so they return to FPC? I think I'm going to answer this, but I invite Manish as a father of some young children to weigh in on this as well. I don't know if you, well, let me back up and start over. I think we're working really hard to keep young families engaged right now. You may not be receiving the emails and all of the different things that our children's ministry is doing, but there is literally a barrage of songs and games and funny jokes and things like that have been going out on almost a daily basis, although that's slowing down a bit. And we've been recording all week our virtual VBS to keep the children and their families engaged and active in the church. And hopefully, as we are able to open up in homes more and we have the opportunity to continue to provide resources to our small groups, that is another way that we can keep families with young children engaged. Manish, anything that you would want to add to that?
Yeah, sure. So I have an 8-year-old daughter and an almost 11-year-old son on Monday. Happy birthday, Rohan. I feel like they've actually been quite engaged over the past 2 months, and I think that's a testimony to our amazing children's ministry staff. Even in late March, when things were just starting with this, I was quite impressed at as Jim mentioned, the daily emails with memory verses and songs and Fun Friday with jokes, and really involving the kids in submitting content. And they even had a check-in with some of their Sunday school classes to keep them engaged. My kids are in the choir, in the children's choir, and so they've been having choir every Sunday and doing it from our dining room. And you probably saw that over the past few weeks when they've sang. There have been other creative ways that our children's ministry staff have involved them as well. You may have noticed them giving Mother's Day messages. And so I think that I think this is an opportunity for creativity and innovation. And I have seen that from the team here at the church.
What are the summer plans for our youth group considering social distancing guidelines? Manish.
Yes. Great question. And this is something that we are still working on in our reopening task force plan. We have started having those conversations. Several members of our task force are specifically tasked with addressing children and youth, and have been talking to staff members at the church that work in those ministry areas, have been talking to parent advisory groups to understand desires and needs. And so we are currently in the process of understanding those needs, determining what recommendations would promote safety while still encouraging people to grow in their faith. We know that those summer experiences are valuable times One of my favorite Sundays is when we celebrate our graduating high school seniors, and I loved the testimonies that were shared just a few weeks ago. And when you listen to those testimonies, you hear about the impact that the youth ministry has on their lives. And so we know that those are valuable experiences, and we want to do everything that we can as a task force to promote that growth and that community while still keeping people safe. And so these are still details that we're still working on. And so we'll have more information, I think, to share in the coming weeks.
And that's, one thing that I'll say to maybe reinforce the obvious, but this is a plan for opening. And as things evolve, as things change, we'll be able to do some things differently, and hopefully the trend is going to continue in the direction of allowing things to relax. So I don't know whether we'll have more virtual town halls, but that will be the opportunity for us to continue to evolve in some of these areas. And I guess it's another way for me to say that it's very important for us to hear from you. And so, again, thank you for taking the survey. Thank you for these questions. And don't hesitate to send your emails to Mark Potter at, no, I'm kidding. But please don't hesitate to email us and let us know of concerns that you have or great ideas that you have. Okay, this question. Have you read the articles about how COVID-19 is muting to a high death situation for some children, over 100 cases in the New York area, and they go into toxic shock? How is this being factored into the reopening plans?
So I'll take that question. You may have seen in the media that there are reports of what they're calling a multi-system inflammatory syndrome in children. That's a sequelae of the infection with the virus, and that there have been a number of cases in the New York area. Yes, we're aware of that. That's something that is fairly new, I think, in the media, but we've been hearing reports about this and seeing reports in the medical literature as well. I think that locally, I've only heard of one case of that myself. I do have a colleague who I was actually just on a Zoom call with, who I was in residency with, and she works in New York City, and she has been seeing these kids. So it is a real thing. We haven't seen it so much in Houston. But in terms of how is this being factored into the reopening plans? As I mentioned earlier, we do plan to have children who are 0 to 4 years old stay at home, and that's for their safety and for everyone else's safety. Although we know that kids seem to be less affected by this overall, and that's why they're not listed in that high-risk age group, we also know that this is something that we are starting to see in that age group. In terms of how is this being factored into reopening plans, I think overall, all of the infection control things that we are planning to implement are protective for anyone who comes. And so regardless of whether you're 50 years old or you're 10 years old, these infection control practices, we believe, will make this environment safe to resume in-person worship. And so this is how it's being factored into those plans.
And Manish, I might add, and you can comment on it, that's also part of why we're not opening children's Sunday school or anything like that.
Yes, that is why. That's another reason why, because we know that from the medical literature that half of kids that have the coronavirus actually don't even have symptoms. And so if they came, they could screen negative and by our screen, and then they could be sitting here and have it. And so for the older kids who we are welcoming, who are going to wear a mask and use hand hygiene and stay 6 feet apart from people that are not in their household, then we do think that is safe. But we know that that's hard to do. My kids aren't this old anymore, but when they were 2, I know that it's hard to keep them from touching things or putting their fingers in their mouth. And so for that reason, we don't want you as a adult caregiver of a small child to be so focused on being mindful of that with your small child that you can't focus on in-person worship, and it's safer for the community as well.
Have you considered having services outside? This fulfills part of our mission statement and allows social distancing to be easier. I'll handle this one. Yeah, we have considered that, as a matter of fact. Probably not part of our regular Sunday morning worship services, and certainly not in the summer. But we have talked about these beautiful oak trees that we have in front of the church, and the ability eventually to maybe gather informally in some early morning or late evening compline kind of worship service that not only would give us an opportunity to gather safely, but also might be an interesting witness to our community. So we are considering that, and but like I said, probably not at the beginning, and probably not in the summer, at least on a Sunday morning. Could we have some gatherings that would be outside in the evening or a sunrise service? Yeah, that is something, as I mentioned, that I've had that idea a few days ago from a couple of different people, and we certainly want to investigate that. It could be a lot of fun and very meaningful. Okay, my wife and I are in our mid to late 70s. We both have underlying conditions that have been repaired or are considered well-maintained with medication. In addition, my wife has a pacemaker. We would clearly fall into the group of higher risk of complications if we contracted the virus. Or, I'm sorry, that's a question. Would we clearly fall into the group of a higher risk of complication if we contracted the virus? We have been given conflicting advice by various medical providers.
Sure, so I can take that one. So age alone is a risk factor. So if you are over 65 and you have a complete clean bill of health and have never had any other medical problem, regardless of that, age alone is a risk factor. So then when you add on top of that you may have a heart condition with a pacemaker, then that does add additional risk. And so yes, for the person who submitted the question, yes, I would say you do clearly fall into the high-risk category.
Will valet parking be available? Mark, you want to handle it?
We believe so at this point. We haven't finalized it yet.
So we, and I can add to that, we had a discussion about this. So the first Sunday, we have chosen not to have it initially, but in the spirit of keeping things simple, as Jim has reminded our task force, when we start with that first day opening, we want to make sure that everything goes as smoothly as possible, and having and then once we're able to have that first smooth Sunday, then we can start adding additional services and additional things to that. And so we did discuss having valet from day one. We decided to hold off because we also wanted to look into proper safety procedures for the valet driver as well.
Can we bring our own Bibles? Yes, you are highly encouraged to bring your own Bible, and that may be something that will stick with us as we go forward, right? So yes, please do. Why not live stream the service versus pre-record? So there may be two questions in this, and let me take this. One question is, with respect to pre-recorded versus live stream, we will probably do a little bit of both. But as I mentioned in the presentation, we've discovered that we can be much more creative with a pre-recorded service. And by that, I'm not meaning do it from different rooms of the building or necessarily, or to film it in another room, although we got a lot of great feedback with respect to the service that was filmed in the living room. Basically, if we do a live stream here in the sanctuary, it prohibits us from doing any videos. We can't include the children's choir like we did a couple of Sundays ago. We can't do a testimony. We can't play the greatest hits because our platform just doesn't allow us to do that. So by pre-recording, we can have the beauty and the benefit of being in the sanctuary, but also the ability to add to that some of the choir anthems that we pull out of our archives, or to hear a testimony, or to see our children's choir. So that would be those are the pros and cons between pre-recorded and live stream. I did have somebody ask me yesterday too, why wouldn't we just live stream the live service? Mm-hmm. And again, what we've learned over the last 2 months is that live streaming, as we used to do it, is not sufficient for producing a great service that allows you to have a greater sense of intimacy and closeness to speakers and singers. If I could flip the cameras around, for example, you would see that we have 3 cameras now in the center aisle and in some of the pews in order to get you closer to what is taking place. And the reason for that, so if you had to come in, there you go, if you had to come in and try to sit behind these wonderful people, we'd be blocking sight lines and things of that nature. And so that's why we favor pre-recording over live stream at this point, and why we're not just going to live stream the service as we used to. Is there a plan to cast the audio to outside the building for those that feel comfortable or want to worship outside? No, there isn't a plan at the moment, but that's certainly something that we could consider, assuming that we have the technology or could develop the technology to do that. So that's a great idea. We'll see it and get back to you on that. Will the sermon be the same for in-person versus online services? Will the sermon and the pastor delivering the sermon be the same? Yes. It might not be exactly the same because the pastor, whoever is preaching, might say it slightly differently when it's pre-recorded than when it's live, but it will be the same pastor giving the same sermon, hopefully in the same fashion that it was given when it was pre-recorded. Great question. This is a comment, and it's also the last one. Thanks to all who have donated their time researching and making a plan to keep us safe. And boy, do I want to say amen to that. Manish and Mark and all of the people that they represent have put hours into this research, into debating. I want to tell you, those of you that have been on Presbyterian committees before, we've had some really spirited discussions. And it has been, at times, folks who have spirited in the Lord, but still spirited, including the session meeting last night, which was a very thorough discussion and vetting of the recommendations that have been made to this point. So thank you, Manish, and thank you, Mark, for being here tonight and for this presentation. Thank you again to our incredible and intrepid media team. And unless there's one last question that slips in under the wire, I want to thank you for being present with us tonight. Please do feel free to email us if there's a question that comes to you later, or if you have another concern. I hope we'll see you this coming Sunday in worship, and we do pray that soon we will see you live and in person here in our sanctuary on our campus. Keep praying for the Lord to lift this virus from the entire world. Keep praying for those cities and those parts of the world that are suffering greatly at this moment. Give thanks to God for the fact that Houston so far has been relatively spared, though not completely. And continue to pray for our leaders locally, statewide, and nationally as they make decisions and lead us forward. Thanks again for tuning in. God bless you all, and we'll see you soon.